Good evening, dears. Today's topic of discussion is infertility and stress factors, the role of coenzyme Q, melatonin, and magnesium.
Lagate Kolaghat is my village and Kolkata is my city. Role in female infertility. Coenzyme Q, melatonin and magnesium. আমরা সবাই জানি infertility is defined as the inability to achieve pregnancy after 12 months or more of regular unprotected sex. It affects millions globally, impacting families and communities with about 1 in 6 people of reproductive age experiencing it in their lifetime. In women, infertility is often due to abnormalities in the ovaries, uterus, fallopian tubes, and endocrine system. 1 in every 15 Indian couples struggle with infertility because there are points like late marriage, demanding lifestyle, obesity, smoking, drinking habits, and excessive consumption of fast food. Being childless is emotionally and physically distressing. Prevalence of infertility in India, prevalence of primary infertility in India is 9.9 to 16.8%. 25% of total couples suffering from infertility are in India alone. Marital infertility rate has raised from 11 women to couple problem. Now it has become a couple problem, at least in society. Infertility is not just a problem among women, men and women of the time it's the male. Rather, in my personal opinion, infertility, male versus female, I just said that. The World Health Organization performed a large multinational study to determine gender distribution and infertility etiology. Most common identified factors of female infertility are as follows: ovulatory disorders 25%, endometriosis 15%, pelvic addictions 12%, tubal blockage 11%, other tubal or uterine abnormalities 11%, and infertility causes. I have already mentioned about female infertility. Regarding male infertility, the points are seminal abnormalities, varicocele, testicular damage, environmental factors, unexplained infertility, genetic disorders, and hormonal defect. The pathophysiology of female infertility is multifactorial and still not fully elucidated. Maternal aging and diminished ovarian reserve are among the most investigated pathogenic or mechanisms. Important factors that impact infertility. Number 1 is oxidative stress. Number 2 is sleep dysregulation. Number 3 is deficiency of macromolecules. Oxidative stress. What is the impact in men? There is impaired semen function. Oxidative DNA, protein, and lipid biomembrane defect, and because this is all because of ROS, reactive oxygen species. In women, oxidative stress impact is follicle and oocyte growth restriction, PCO, or endometriosis or miscarriage, or in case of oocyte, decrease of fertilization rate, mitochondrial dysfunction, and in case of embryo, lowered ATP production and decreased embryo formation and quality. An antioxidant helps in decreasing oxidative stress. In male infertility, there is a recent new concept of male oxidative stress infertility, that is MOSI. It has been proposed and pointed out that about 30 to 80% of infertile men have increased ROS in the sperm, which affected about 37.2 million of infertile men. ROS means free radicals. Oxidative stress defined as There is a balance between disturbance in the balance between production of reactive oxygen species, that is the free radicals, and the antioxidant defense system. The fight between the free radicals and the antioxidant defense system, and that causes oxidative stress. Now we are coming to coenzyme Q. Role of coenzyme Q. Role in male infertility. Low coenzyme Q10 level have been associated with several conditions determining the infertility from oligo to spermia, and the coenzyme Q is one of the most widely used antioxidant in treating idiopathic male infertility. Role in female infertility. Oral supplementation of coenzyme Q may increase CPR, clinical pregnancy rate, when compared with placebo or no treatment in women with infertility undergoing ART procedures. Coenzyme Q restores oocyte mitochondrial function. Polarization, it increases ATP levels. Clinical class, I have just jumped to the conclusion. Conclusion is pre-treatment with CoQ improves ovarian response to stimulation and embryological parameters in young women with poor ovarian reserve in IVF or ICSI cycles. And in other study, the conclusion is as the oral oral supplementation of coenzyme Q may increase CPR, clinical pregnancy rate, when compared with placebo or no treatment in women with infertility undergoing ART procedures without an effect on LBR. LBR means live birth rate. With respect to dosage, the dosage and duration of coenzyme Q supplementation in women with poor ovarian reserve, the dosage varies from 600 mg once a day for 8 weeks to 600 mg twice a daily for 12 weeks or 200 mg TDS for 8 weeks. Regarding melatonin, reduces sleep dysregulation. Melatonin production by age. Melatonin is the only known hormone synthesized by pineal gland and is released in response to darkness. Hence the name, the hormone of darkness. I cannot understand that why the graph is not shown. The graph is there. You can see the red line. The red line is there. That is actually the melatonin secretion falls after 40, and after 60 it goes to minimum. What is the role of melatonin in infertility? See the next slide. If melatonin is not there, sleep dysregulation starts. In men, what happens? Decreased sperm quality, and it affects semen volume, sperm count, progressive motility, sperm morphology, and fertilization capacity. In women, less amount of melatonin quality is decreased, pregnancy loss increases, premature birth increases, stillbirth is there, and low birth weight. Melatonin role in male infertility. Melatonin has been found to regulate reproductive function by modulating the release of gonadotropin releasing hormones. Melatonin is absorbed by testes, where it affects directly by acting on the receptors on intratesticular inflammatory cells. Melatonin exerts anti-inflammatory effect on testicular macrophages. What is the role in female infertility? Melatonin application in ART. A systematic review and meta-analysis of randomized trials, melatonin treatment increases the number of oocyte collected, maturated oocyte, and good quality embryo. Improved intrafollicular oxidative balance and oocyte quality in unexplained infertility patients, leading to a slight increase in pregnancy on live births. The conclusion regarding melatonin is melatonin treatment significantly increases the clinical pregnancy rate Melatonin treatment also increases the number of oocyte collected or mature oocyte or good quality embryo. The next point is magnesium.
One thing,
Mag-
melatonin dose and which name it is marketed in.
Melatonin, it will come next slide. Magnesium helps in steroidogenesis, helps in progesterone synthesis. একটা স্লাইডে বলেছি মেলাটোনিন ডোজের উপরে নির্ভর করছে না আপনার স্লাইডটা পার হয়ে
সেটা
গেছে
বলেছো, তবু তো একটা ডোজ কিছু তো
বলছি বলুন Magnesium is necessary for functioning of reproductive system that is stimulates sperm motility and enhances sperm quality. It is necessary for normal ejaculation and spermatogenesis. In female, helps in improving uterine blood flow, helps in progesterone synthesis. Magnesium supplementation has been successful in treatment of PMS, PCOS and mood disorders. Magnesium 300 milligram role in male infertility. Magnesium is an important trace element. This element is directly associated with calcium and plays a significant role in semen transport, sperm motility and male fertility. Role in female infertility. Effect of magnesium supplement on pregnancy outcomes. A randomized controlled trial conclusion there is magnesium supplement during pregnancy could decrease the probability of occurrence of many complications of pregnancies. We know very well. Here is the brand from Itas, the company who is sponsoring today's program, the Bharpil Max. The dose is there, 3 coenzyme Q, 300 milligram, melatonin 3 milligram and magnesium 300 milligram. Your question is answered. Now my special thanks to Tamrolipto of the Society and Interest Pharmaceutical for giving me the opportunity for today's presentation. Thank you. I think I have done in a short time. Okay.
Thank you, viewers, for patient listening and watching my presentation. Thank you.